You might be wondering what lung rehabilitation is, as it's less well known than the musculoskeletal type of physiotherapy, where we treat muscular strains and joint pains, etc. But we also help people with respiratory problems such as COPD, pneumonia, and bacterial or viral infections. So now more than ever, this type of intervention is so important for the recovery from COVID-19 virus, and also to reduce the long-lasting effects it has on our lung function. Some patients will experience respiratory physiotherapy in the hospital, but those with mild or residual symptoms at home will benefit from these following exercises. Inflammation in the lungs can be caused by viral or bacterial infections, and this can lead to a build-up of fluid and mucus in the lungs. We call this sputum. Sputum takes up precious space in the airways and can trap air in the lungs, leading to coughing, wheezing, breathlessness, and chest tightness. The objective of percussion is to mobilise the sputum in preparation to expectorate. Expectorate is just a fancy word of saying getting sputum out of the lungs. Cup your hand and imagine you're trying to keep some water in your cupped hand, so keep your fingers and your thumb tight, but just make sure your wrist stays floppy. When you hit your chest wall with a cupped hand, you should get a hollow sound, and this will send vibrations through the lungs to start moving the mucus around. So here's the sound of some percussion. So now we want to use some deep breathing to get air behind those pockets of sputum and move them further along the airways towards the exit, which is your mouth. When you take a deep breath in, try to fill every centimetre of your lungs by expanding the rib cage front to back, side to side, and your belly may even poke out because the diaphragm pushes the abdominal contents down and out. However long you breathe in for, try to make your out breath a couple of counts longer. And you can use a little squeeze from your belly to push as much air out of your lungs as possible on the out breath. Just remember to try and keep your neck, shoulders and jaw relaxed. And if you can, it's much better to breathe through your nose than it is through your mouth. But we don't want you to get dizzy by taking too many deep breaths, so 3 is enough at one time. And then it's important to return to some steady breathing afterwards. So again, try to perform this controlled breathing through your nose, as there are many benefits to nasal breathing, not least to lower the risk of respiratory infection. Simply relax and take 6 natural breaths here. No need to force anything with these breaths. You may also want to grab a couple of tissues at this point, ready for the next exercise, which may help with expectoration. So huffing will help move the mucus further up the airways and perhaps even enough for you to spit out, hence the tissues. To huff, you need to take a deep breath in, breathe halfway out, and then make a small circle or O with your lips about 1 centimetre wide. Make sure the lips are pursed or tight, not pouted or pushed out. I'll perform a huff now so you have an idea of the sound you're aiming for. So you want to do 3 or 4 of these at one time. You might find the first one makes you cough and it might bring up some mucus from the lungs, and that might be all you want to do. Otherwise, you might do 3 or 4 of them and you're not bringing up anything, but you just need to practice this series a couple more times before it loosens the sputum enough to be released. Obviously, if you haven't got any sputum, you won't have a productive cough anyway. So it's really great to finish off this series with some rib vibrations if you're able to do this comfortably. If not, you could do a few more deep breaths to finish off, or just return to your controlled breathing and repeat the series again later. Coughing, wheezing, shortness of breath, chest tightness can all lead to your rib cage and diaphragm becoming stiff or tight. So this technique helps bring some spring back into the rib cage by rhythmically squeezing your ribs while you breathe out. This is how my breath sounds if I perform rib vibrations. You might need to go a bit faster or a bit slower. You might need to do the movements more gently to get started. Just make sure it's comfortable for you. And for best results, you want to try and repeat this whole series 3 or 4 times in a day. So just to finish off, stress, anxiety and poor posture can often lead to shallow breathing, which affects every function in the body. Therefore, your deep and controlled breathing exercises are particularly useful for everyone. Percussion and huffing and rib vibrations even are not dangerous if you're well and haven't got a cough. However, you wouldn't need to repeat them on a daily basis if there is no sputum build-up. So thank you for watching, and we hope you learnt something useful. Stay well. You might be wondering what lung rehabilitation is, as it's less well known than the musculoskeletal type of physiotherapy where we treat muscular strains and joint pains, etc. But we also help people with respiratory problems.